All right, so we're working on Chapter 6, the Introduction to the Skeletal System. Last time we talked about the functions of bone and the structure of bones and bone tissue. Now we're going to look at the bone as an organ and talk about bone formation and growth, as well as a little bit of calcium homeostasis. So, bones are organs, and they contain more than just bone tissue. The A typical long bone is showed here with the important parts of the bone labeled. The diaphysis is the shaft of the bone. It's a tube of compact, mostly compact bone that has a hollow space inside it that's filled with yellow marrow, which is basically adipose tissue. The diaphysis is wrapped by a connective tissue membrane called the periosteum. And so that covers the outside surface of the bone and the entire surface. The ends of the bone are referred to as the epiphyses or epiphysis for each. This contains the articulated ends of the bone. Those are the ends that form the joints. The outer part of this structure is going to be made of compact bone. And then on the inside, it will be that trabecular or cancellous or spongy bone that reinforces it and gives it strength in lots of different directions, but makes it light. There will also be inside the spaces of that spongy bone is red bone marrow. That's the tissue that is going to give rise to new red blood cells. The ends of the epiphyses that are in joints, those are covered with articular cartilages. So the surface of the bone is entirely other tissue besides bone, either periosteum, osteum, or articular cartilages. And what they show here as these growth lines, these are the epiphyseal discs. This is where bones grow. And so you see it in the cross section on top as the growth lines. Long bones form in the embryo as cartilage models. And so they're referred to as cartilage bones. Generally, the cartilage forms in the rough shape of the bone. It forms first, again, as a cartilage, but later on, you will get bone cells, osteoblasts, invading that bone and beginning to deposit bone, replacing that cartilage tissue. This usually happens first in the diaphysis, which we refer to as the primary ossification center, and then later in the epiphyses. And so these are the secondary ossification centers. As more bone tissue is deposited, more blood vessels enter the bone, and gradually bone cells replace cartilage. Okay, all the cartilage will be replaced eventually, except at this disc of cartilage between the primary ossification center and the secondary ossification center. This will be the epiphyseal disc, the growth plate, and growth will continue there generally until a person is somewhere in puberty. Now, some other bones form in different ways. These bones form as membranes. They form underneath the skin in connective tissues below the skin, and those connective tissues, again, are invaded by osteoblasts. And these osteoblasts will form trabeculae, cancellous bone, and they'll start forming in a central area, and the bone will kind of grow towards the edges. And so this ossification center will grow towards the edges until it meets up with another growing bone. This happens in broad, flat bones like the bones of the skull or the hip. And these bones, most of that connective tissue will be replaced, except for a small gap between different bones, and that's where bone growth will occur after birth. All right. So that kind of brings us to talking a little bit about calcium homeostasis. The bones play a crucial role in the physiology of calcium. Calcium is really, really important. It's not just a component of bone. Calcium is needed for many enzymes to work. It's needed for blood clotting. It's needed for contraction of muscle, including heart muscle. It's really, really important. And the level of calcium is maintained within a narrow range. Um, and the if calcium levels are insufficient in the diet, that will cause a hormonal change that will cause a release of calcium from the bone as a kind of an emergency protection measure. So we have this homeostatic mechanism, and we have two hormones. Calcitonin, which is released by the thyroid gland, the thyroid gland releases this when calcium levels are above the amount that's needed. That causes osteoblasts to deposit calcium in new matrix, and so it causes bones to thicken. And so this takes that extra calcium out of the blood and stores it in the bone. If calcium levels in the blood fall, another gland, the parathyroid gland, releases parathyroid hormone. And parathyroid hormone will cause the release of calcium from the bone. Uh, the cells that do this are called the osteoclasts, and that will help restore the level of calcium back to normal. Parathyroid hormone also causes the kidneys to be better at reabsorbing calcium from urine, and it causes the intestine to be better at absorbing calcium from food. Okay, so bone growth and remodeling occurs throughout. Growth occurs mainly during the early years, but remodeling occurs throughout life. Uh, Bone growth in length occurs at these epiphyseal discs at the ends of bones. And so you can see this child's hand here. It looks like there's a gap between the bones of the hands and the fingers, but then you can see little dots there, and that's those dots there are the gap between those dots is the epiphyseal disc, and those dots are the epiphyseus. And so this is growth and length that occurs during your growing years. Growth and length will cease when you're an adult and you've lost the cartilage in that growth plate. And then your bones can no longer grow in length, but they can change in widths. If you undergo new activities or get a job that requires a lot of physical demands, your bones can thicken. And likewise, if you become less and less active, they can thin, releasing calcium to be used elsewhere. And so remodeling occurs throughout life. One unfortunate context, of this is a disease called osteoporosis that affects millions of Americans and causes something like 1.5 million bone fractures a year. This is where the bones progressively thin until they are so weak that they can spontaneously break on their own. This is caused primarily by age, but also by diet and gender and activities that reduce the amount of calcium in the blood, like smoking and alcohol. Some activities are protective. Maintaining healthy weights, engaging in vigorous exercise, and having good calcium in the diet are protective. But in other cases, this tends to happen as people decrease in age and the hormones that promote normal bone formation start decreasing. And you can see this as older people kind of shrink, and that's caused by compression fractures in their back. This is a problem more for women than for men, because for women, at menopause, they have a rapid decrease in the amount of estrogen circulating in their blood. And estrogen promotes bone formation, and so suddenly they're less likely to form new bone. For men, it's a much more gradual decrease in their hormone levels. Okay, so let's summarize here. Functions of the skeletal system include protection, support, movement, calcium and fat storage, and homeostasis. Bones, most bones are long bones. There are some that are short or flat bones as well. Long bones have the following structures: diaphysis, epiphysis, medullary cavities, yellow bone marrow, red bone marrow, and endosteum and periosteum. Bone tissues include compact bone and spongy bone. Bone formation is either cartilage or membrane bone, and bones play a role in calcium storage and homeostasis.